Hey, Dr. Robinson. Thanks for letting me stop by today. You have a beautiful clinic. How have you been?
Oh, I've been doing really well, Dr. Penner. How are you doing?
I'm doing really well too. Yeah, it's really good to see you. The reason I stopped by is that we have a statewide initiative on addressing opioid prescribing right now. And I just wanted to get your thoughts on opioid tapering and how that experience has been with you recently.
Oh, that's such a great question. So honestly, I'm a little hesitant to taper. I've had some chronic pain patients who probably require tapering, but they're on stable doses of medication, their pain's controlled, and so it's kind of like, why rock the boat?
Yeah, I can really understand that. When patients have been stable with controlled pain, they're satisfied and have been for 10 plus years, why change therapy? But more and more evidence is coming out about the long-term effects of opioids, including hypogonadism, immunosuppression, and hyperalgesia. So it's really important that we address these long-term risks with our patients to emphasize that this might not be a good long-term solution.
No, that is a really good point. I really just do need to do something about it, but honestly, I'm a little nervous about doing it. I'm not necessarily sure exactly how to go about tapering someone who's been on medications for, I have a patient for 10 years who's stable. So what would you recommend?
Yeah, all those fears are very valid. Just like starting an opioid prescription, we have to be just as cautious when we're stopping an opioid prescription. My first step that I recommend is just having a discussion with your patient about the risks and benefits of their therapy, and then getting their approval and their buy-in on the opioid taper before you progress. But if they have your approval, or if you get their approval, I should say, and they're ready to start that process, the CDC and DHSS do have good guidance for us on the best way to manage these tapers in patients who have been stable for a long time on opioids and aren't experiencing any immediate side effects. So they do recommend starting with a 10% taper per month. And I recommend starting with that 10% taper of their total daily dose of opioids and then following up within 1 to 4 weeks or so. And then at that point, you can decide whether to continue at that rate or increase the speed of the taper or potentially decrease the speed of the taper based on how they're responding.
That's a really good point. So I have used clonidine in the past to address some of the withdrawal symptoms that you were kind of describing. Are there other adjunct therapies that I should have maybe addressed?
Yeah, that's a great point. I think that a best practice is probably to prescribe a withdrawal kind of to-go kit. Clonidine being one of those medications that helps with the autonomic nervous system effects, such as anxiety, restlessness, GI irritation. But some patients don't tolerate the clonidine because of the hypotension and dizziness that can happen. So alternatively, we can offer hydroxyzine because it also helps with the autonomic nervous system effects, but can also help with some of the insomnia that comes along with opioid withdrawal. Additionally, we can provide medications for GI upset, such as Zofran or loperamide. And then we can also consider things like NSAIDs for short-term use for muscle pain, and then maybe even trazodone for a short burst for insomnia. And that's just really important to follow up with our patients frequently to assess their withdrawal symptoms using our clinical opiate withdrawal scale and make sure that they're still comfortable. Because you may have seen the recent studies showing increased mortality in patients who underwent opioid tapering, but most of those studies were done prior to the DHSS guidance in 2019, really emphasizing that slow opioid tapering is the safest way to go.
No, that sounds perfect. But I might end up needing to call you eventually just to double check on some of these really complicated patients. But I think that this absolutely is something I should do.
Okay, well, I have a couple resources for you. We did create this handout about chronic pain management, and it does have resources from CDC and some of the VA tapering tools that you can find with the QR codes here. In addition to those resources, my card is here, and I'm happy to help out with customizing tapering plans and even following up with patients at the pharmacy to see how they're doing.
No, that would be wonderful. Thank you so much.
Yeah, it was great seeing you today. I'm interested to see how things go, and maybe I'll just come by within the next month to touch base.
That sounds perfect.
Awesome.
Thank you, Dr. Penner.
No problem.